Robotics in embryology. Robotic systems for gamete handling and embryo manipulation. Robotics in embryology is transforming the field of assisted reproductive technology, ART, by improving the precision, efficiency, and safety of gamete handling and embryo manipulation. These technologies allow for more accurate, repeatable, and controlled procedures, reducing human error and variability in fertility treatments, such as in vitro fertilization, IVF. The use of robotic system in embryology ranges from sperm injection, ICSI, to embryo biopsy and even automated embryo culture management. By integrating advanced robotics, artificial intelligence, AI, and microsurgery tools, embryologists can manipulate gametes and embryos with high precision, improving overall outcomes and minimizing risk to the embryo and gametes. 1. Introduction to robotics in embryology. What is robotic embryology? Robotic embryology refers to the use of robotic systems in the handling, manipulation, and culture of gametes, sperm and eggs, and embryos during fertility treatments like IVF. Robotic systems enhance the precision and control of delicate tasks that are typically performed manually by embryologists. Benefits of robotic systems in embryology. Precision and accuracy. Robots can perform complex movements with high precision, reducing human error and enhancing embryo quality. Increased reproducibility. Robotics ensures that processes like embryo handling and gamete injection are consistent across cases. Reduce risk of contamination. Robots can work in controlled, sterile environments, minimizing the chances of contamination during procedures. Time efficiency. Automation speeds up repetitive tasks, such as gamete selection or embryo monitoring, allowing embryologists to focus on more complex aspects of ART. Second, robotic systems for gamete handling. A robotic sperm injection, ICSI, intracytoplasmic sperm injection, a key embryology procedure used to treat male infertility by directly injecting single sperm into an egg. Robotic systems are used to perform ICSI with higher precision, controlling the insertion of sperm into the oocyte without causing damage. Robots can offer more consistent results, reduce human error, and enable reliable sperm injection for male infertility cases. Robotic systems for ICSI. Robotic manipulators offer precise control over microsurgical instruments used in ICSI, ensuring that the sperm is injected accurately into the egg's cytoplasm. AI-assisted guidance systems can help embryologists select the best sperm for ICSI, analyzing sperm motility, morphology, and DNA integrity. B. Robotic oocyte handling. Oocyte egg aspiration. Robotic systems are used to automate the aspiration and collection of oocytes from the ovaries during egg retrieval in IVF. By automating the aspiration process, robotic systems ensure more consistent collection of eggs and improve ovarian stimulation procedures. Oocyte monitoring. Robotics can assist in the monitoring of oocyte maturation by enabling precise manipulation of eggs within culture media. Robotic systems can be integrated with advanced imaging tools, allowing continuous, real-time monitoring of oocyte development. Third, robotic systems for embryo manipulation. A. Embryo culture and monitoring. Embryo culture systems. Robotic incubators and culture systems can provide highly controlled environments for embryo growth. Temperature, pH, humidity, and gas levels, e.g., CO2, O2, are all controlled with robotic precision to maintain optimal conditions for embryo development. Embryo monitoring and grading. Robotic systems equipped with microscale cameras and AI algorithms can perform embryo grading, analyzing factors like cell division, embryo quality, and blastocyst formation. Robots can also perform non-invasive imaging of embryos, enhancing the ability to choose the most viable embryos for implantation during IVF. B. Embryo biopsy and genetic testing. Embryo biopsy. Robotic systems are increasingly used for embryo biopsy, a procedure where a single cell is removed from the embryo for genetic testing. The use of robotic systems ensures precision in cell removal without damaging the embryo, improving the success rates of genetic testing like pre-implantation genetic testing, PGT, and robotic assistance. Robots can assist in embryo biopsy procedures, ensuring that only the desired number of cells are removed for genetic testing. Robotic systems are also used to automatically prepare embryos for genetic analysis, reducing human error during the biopsy and analysis process. Fourth, robotic systems for embryo transfer. A. Embryo transfer process. Embryo transfer. Robotic assistance in the embryo. Transfer process involves precise placement of embryos into the uterus using robotic arms and a specially designed catheter. Minimized risk of trauma. Robotics provide more control during the placement of embryos, ensuring optimal embryo positioning and reducing discomfort for the patient. B. Robotic precision in embryo placement. Robotic systems allow for accurate targeting and gentle placement of embryos, reducing the risk of embryo damage or misplacement during the procedure. Automated monitoring systems integrated with the robotic platform allow for real-time adjustments, ensuring the highest chances of successful implantation. 5. Advantages of robotic systems in embryology. A. Precision and consistency. Minimize human error. Robotics provide enhanced precision in delicate procedures like gamete injection or embryo biopsy, which could lead to improved outcomes. Consistency. Robots can perform repeated procedures with consistent quality, making ART treatments more reliable. B. Enhanced reproducibility and efficiency. By automating repetitive tasks, robots increase efficiency and reduce the time needed for gamete handling and embryo manipulation, resulting in higher throughput of procedures. C. Reduced risk of contamination. Robotic systems work in sterile environments with minimal human interaction, reducing the risk of contamination during processes like embryo handling or gamete preparation. Sixth, challenges and limitations of robotic systems in embryology. A. High cost of implementation. The cost of installing and maintaining robotic systems in embryology labs can be prohibitive, especially for small clinics or labs with limited resources. B. Technical limitations. Robotics still require expert supervision by embryologists and are typically used for specific tasks. For instance, complex decisions in embryo grading and genetic testing still require human oversight and judgment. C. Training and adoption. Embryologists and fertility specialists must undergo specialized training to use robotic systems effectively, which may create an adoption barrier in clinics without trained personnel. 7. Future prospects of robotics in embryology. Improved AI integration. With the continuous development of AI, robotic systems may evolve to not only handle tasks, but also provide real-time feedback and decision support during treatments. Fully automated IVF. Robotic systems could play a major role in the development of fully automated IVF procedures, where the entire process, from gamete collection to embryo transfer, is performed by robots. Personalized treatments. Advanced robotics could be integrated with personalized fertility treatments based on a patient's genetic profile, leading to more targeted, effective, and safe treatments. 8. Conclusion. Robotic systems in embryology are advancing the precision and effectiveness of fertility treatments, from gamete handling and embryo manipulation to embryo transfer and genetic testing. While the technology is still evolving, its potential to improve success rates, reduce risks, and enhance efficiency in assisted reproduction is immense. As robotics, AI, and automation continue to progress, these technologies are set to play an increasingly important role in the future of reproductive medicine.